Hello, everybody, and welcome to today's presentation, Fitness Strategies for a Healthy Heart, kicking off our Men's Health Week 2025. If you have not met me yet, my name is Sydney Szczesniakowski, and I am your wellness tech here at Pinellas County. My background is I have been a personal trainer for a little over 3 years, as well as my master's is in exercise science. So that's kind of why I'm talking to fitness strategies that you can do and implement to keep your heart healthy. So kind of just going over what today's presentation is going to be. We're going to briefly talk about heart disease. I am not a doctor, so this is not an extensive presentation on what heart disease is, but just kind of so we're on the same page, we're going to especially talk about some of the most common types, specific risks for men, the impact of exercise on your heart health, some fitness strategies you can incorporate into your life, and finishing off with some resources and questions. So, understanding heart disease. When we talk about heart disease, we're really talking about a range of conditions that affect how the heart works. This can mean problems with the structure of the heart itself, like faulty valves or weakened heart muscles, or it can involve the blood vessels that supply the heart. One of the most common types. So, understanding heart disease. When we talk about heart disease, we're really talking about a range of conditions that affect how the heart works. This can be problems with the structure of the heart itself, like faulty valves or weakened heart muscles, or it can involve the blood vessels that supply the heart. One of the most common types is coronary artery disease that you can see right here in the picture, pointing out the fatty deposits. So this is where arteries become clogged with plaque and reduce blood flow. A few others to mention, heart failure happens when the heart can't pump blood as effectively as it should. Valve disease affects how blood flows between the heart's chambers, and abnormal rhythms, also called arrhythmias, cause the heart to beat too fast, too slow, or irregularly. Kind of moving into certain risk factors for heart disease that differ specifically for men. And this is not to alarm anyone or scare you or stress you out at the time of this presentation, but it's rather to empower you with knowledge about these differences and how you can be proactive. So kind of first things first, biological sex. So men tend to develop cardiovascular disease approximately 7 to 10 years earlier than women. This earlier onset is partly due to the protective effects of estrogen in premenopausal women, which men will lack. By age 40, the lifetime risk of developing coronary heart disease is about 50% for men, while only 33% for women. This underscores the importance for men to begin heart health screenings and preventive measures earlier in life. Moving into a few that will definitely affect men specifically. So erectile dysfunction, ED can be, is not always, but can be an early warning sign of cardiovascular issues. The same factors that impede blood flow to the heart can affect blood flow elsewhere. Men with ED have a 59% higher risk of developing ischemic heart disease and a 34% higher risk of stroke. Addressing ED with a healthcare provider isn't just about improving quality of life, it can also prompt early detection of underlying heart conditions. Now, low testosterone levels have been linked to increased risks of heart disease and type 2 diabetes. If you're experiencing symptoms like fatigue, decreased libido, or mood changes, discussing testosterone levels with your doctor could be beneficial for overall heart health and well-being. Kind of moving into more environmental, societal impacts, we're going to talk about the emotional impact, how that's a bit different for men, and then lifestyle factors as well. So, men often work in high stress environments with long hours and demanding responsibilities. This stress can raise blood pressure, increase cortisol, and promote inflammation, all of which adds strain to the heart. Social expectations may discourage men from expressing emotions or seeking help for conditions such as chronic stress, anxiety, or depression. These stressors quietly increase the risk for cardiovascular disease, especially if they're over a long period of time. Stress is normal. It happens to everybody. It's not necessarily bad, but when it's chronic and we're not really dealing with what's going on and you're just living in this state of heightened awareness or anxiety or depression and not seeking help for fear of what your friends may say or what your family may say, it's essential to recognize that caring for heart health includes your mental well-being. Seeking support for stress or emotional challenges is not weakness. It is being proactive about your heart care. And when it comes to lifestyle choices, research does show that men are often more likely to engage in behaviors that put their heart health at risk. This includes things like smoking more, drinking higher amounts of alcohol, skipping routine checkups, and not eating enough fruits and vegetables. Plus, many men may be more likely to engage in risky activities that can affect overall health. Incorporating regular physical activity, balanced nutrition, and routine health checkups can substantially reduce cardiovascular risk. The reason I bring up symptoms for cardiovascular disease in men is not, again, because I'm not a doctor telling you what exactly a heart attack or a heart situation is going to look like. These can vary in men depending on the specific condition, but some of these are the most common ones, okay? Again, I don't bring up symptoms of cardiovascular disease because I'm a doctor telling you exactly what's going on with you and your specific heart condition. I bring this up because recognizing these early signs is absolutely crucial as it can truly save lives. Unfortunately, many men tend to downplay these symptoms, often attributing it to stress, indigestion, a pulled muscle, but these hesitations can have serious consequences. Resources from the CDC and the National Heart, Lung, and Blood Institute point out that men are more likely to delay seeking medical attention for heart-related symptoms. In fact, a 2018 study found that delays in seeking treatment are common among men, often because of denial, embarrassment, or a desire not to interrupt their daily lives. You know your body best. Now, you may not be super in tune with your body, and that is what it is. But if something is a little abnormal, a little out of the ordinary, and you kind of think and you're like, it may be something, but I don't have the time to deal with it. Or I don't want to go see my doctor because I don't want to go see my doctor. I don't want to take the time to make an appointment. I have so many other things to do, or even just an internal sense of maybe some underlying feelings of embarrassment or anxiety. Again, maybe if we think we don't go to the doctor, then nothing's wrong. That's not really how health conditions work. So again, I'm pointing these out, not because I'm a doctor, but because these are symptoms of cardiovascular disease. And maybe if you see a few on here and you're like, okay, if all of these start to line up, maybe I'm not just tired from a long day. Maybe I should go see my physician. That's kind of the point of this section is it's important to trust your instincts and seek help. Medical providers would always rather see you early and give you reassurance that nothing serious is going on rather than risk missing a life-threatening condition. Again, it can be a hassle to go to the doctor sometimes, emotionally, time-wise, but it's still important that you go for longevity purposes and just being informed about your health so that you can make educated decisions going forward. Just because we ignore something doesn't mean it's not there. So now that we've kind of talked about what heart disease is, some risk factors specifically for men, and some symptoms of cardiovascular disease and the importance of seeking help when necessary, let's shift our focus to more of a prevention and a preventative route with exercise, movement, physical activity. Staying active plays a key role in strengthening your heart and reducing overall risk. First things first, making your heart stronger. So regular exercise like walking, jogging, or swimming makes your heart's main pumping chamber, the left ventricle, stronger and more efficient. This means your heart can pump more blood with each beat, so it doesn't need to work as hard. Over time, this lowers your resting heart rate and helps your heart work more smoothly. I don't know if you guys have ever read an article about like an athlete's resting heart rate being in the 30s, 40s, or something along those lines. And maybe you're curious as to what the average person's resting heart rate is. It's around 75 to 80. There's a little bit of a range, but most people, it's pretty high, which makes sense. You know, your heart's continuously working, your body's adapting, it's becoming more efficient. So at rest, when you're kind of just chilling, the heart doesn't need to work that hard. So implementing exercise and regular physical activity can kind of get your body in that state. Now, I'm not saying you're going to have a resting heart rate of 30 and become a professional athlete all of a sudden, but we can help our heart work more efficiently by implementing some healthy habits in our life. Lowering blood pressure. So exercise helps your blood vessels stay flexible and open when your heart beats. This lowers the pressure your heart needs to pump blood through your body. It also helps the inside of your blood vessels release natural chemicals that relax and widen them, thus reducing blood pressure. When you exercise, your body builds more tiny blood vessels called capillaries that deliver oxygen to your muscles and organs. It also makes your blood just a bit thinner and reduces the chance of clots forming. This means better overall circulation and a lower risk of heart attacks or strokes. Touching on cholesterol, which if you remember coronary artery disease, let's go back and take a look. Coronary artery disease, we see that plaque buildup in the artery. Exercise can help your body remove the bad, so the LDL cholesterol from your blood and turn it into waste. It also raises the good HDL cholesterol, which cleans up excess cholesterol from your arteries. This reduces the buildup of plaque in your blood vessels and keeps your heart healthy. Moving on to blood sugar. When you move more, your muscles use sugar from your blood more effectively, keeping blood sugar levels steady. Exercise also burns calories, helping you stay at a healthy weight. This lowers your risk for type 2 diabetes, which can lead to heart problems if uncontrolled. And then finally here, exercise makes your brain release endorphins, those feel-good natural chemicals that boost your mood, reduce stress, make you feel good after a workout. It also reduces stress hormones like cortisol that can harm your heart over time. Since chronic stress can raise blood pressure and cause inflammation, managing it through exercise is fantastic for heart health. All right. Now, how do we do all that? How do we get all those wonderful benefits from exercise? Entering in your exercise recommendations. So, at least 150 minutes per week of moderate intensity aerobic activity. I like to say moderate intensity is if somebody was with you and you guys were on like a brisk walk, you could carry on a conversation. You might get a little out of breath, but you can still carry on that conversation. Whereas when we move into that 5 minutes a week of vigorous intensity aerobic activity, we're not getting in sentences anymore. Huffing, puffing, fighting. We're fighting to keep it going. But you should not be able to carry on a conversation at a vigorous intensity. That's why the recommendation is much lower. Also because it does take the body a little bit longer to recover from activity like that. Think of running, sprinting, HIIT, so high intensity interval training, whereas your moderate intensity, depending on your fitness level, could be something like dancing, a brisk walk, swimming, something a little bit more casual. On top of aerobic activity, the CDC recommends including muscle strengthening activities for all major muscle groups on at least 2 days per week. So this could be weightlifting, this could be a yoga class, this can be with resistance bands, body weight. Really just find out what you like the most. And that's going to be the important part. As you see down at our last point, be consistent. You may be able to force yourself to exercise. It's not going to be enjoyable. And when you like something, you are more likely to do it and to do it for a long period of time, which is what we want, which is what your heart and your body wants. It wants regular, consistent physical activity. And research supports accumulated bouts of exercise as short as just 10 minutes for heart health benefits. So incorporating activity into daily routines like walking while taking a meeting or using stairs, parking farther away from the office, standing at work, or taking like a quick stretch break in between your meetings, it all adds up over time and helps reduce sedentary behavior, which is a key risk factor for heart disease. And these small changes enhance adherence and are especially helpful if you're busy. So if you see these 150 minutes or 75 minutes, whatever, and you're overwhelmed already, you're like, there is no way I got 150 extra minutes of my week to exercise. 30 minutes, 5 days a week. If you take a 10-minute walk now after this presentation and maybe another 10-minute walk a little bit later, you only have another 10 minutes to have to move to meet your recommendations, and you just do that 4 more times for a total of 5 days a week. You can break it up however you need to. Exercise has become something that I think we get so overwhelmed by the information that's out there, and you kind of run into decision fatigue, and it's just like there's too many rules, too many regulations to this. That's not it. That's not it at all. Coming from a fitness professional, expert, if you will, just move your body. Start now, move your body, find things that you like, and work your way up to these recommendations. You don't have to hit this right away. If this is not realistic for you, if you haven't moved in the past 10 years, ignore this. Just start by moving a little bit more than you do now and work your way up. Exercise does not have rules necessarily. It's whatever is going to work best for you. Because ultimately, like this last point says, consistency is going to be key. That is what's going to make these differences. That is what's going to get you the health benefits that we just talked about for your heart, your mind, your body, all of that stuff. All of these benefits are going to come from staying consistent. And just to go over some quick resources, we do have group fitness classes here at Pinellas County. Please join us. We'd love to have you. There is a little bit of everything for everybody. Exercise libraries are a fantastic tool. If maybe you're not sure what a good chest exercise is, or maybe you have a rower in your gym and you have no idea how to use it. Using these exercise libraries, you can search by muscle group, equipment available. You click on them, there's demo videos. Exercise doesn't have to be hard. The hard part is the actual exercise part. Let's make getting there a little bit easier. So these libraries are a great tool to use. The Set for Set exercise article library is just a little bit more in depth. So if you like to read about the exercises that you're doing and really specifically how they benefit you, that's a great, more in-depth resource. And then for those on the county health plan, Hinge Health and One Pass Select are also great tools. Hinge Health is a free digital physical therapy program to help you work through aches and pains, because that can definitely sometimes be an obstacle for exercise and movement. So that's a great tool to help you get through some of those issues. And then One Pass Select just really opens up the opportunities in the gym location that you can utilize as well. And that is going to be the end of today's presentation. I hope you all have a wonderful day, and thank you so much for tuning in. I appreciate you. And if there's one thing that you take away from here, be proactive about your health. Who cares what society says? Who cares if it's looking weak or whatever? Your health is important, not only for you, but to your loved ones. So if you don't do it for you, do it for the people in your life that love you and care about you. Have a great day, everybody.